Okay.
Okay, go ahead, next question. Yeah.
Is there a parallel in nature? I have a dog. She eats grass. I'm told the grass helps her stomach become better settled or something. Oftentimes she'll vomit the grass, but she seems to be okay with that. Are there animals in nature that do something that is similar to, where they find the thing that can make them, I don't know.
Yeah, that's a good question. I don't think so. I have to think about that more, but I can tell you that animals are treated with homeopathy and respond,
Sure.
Very well.
Yeah.
Which kind of, the fact that infants can be treated with homeopathy successfully and animals can be treated kind of basically puts to rest the whole notion of homeopathy being placebo. Because obviously animals or infants don't know what they're getting. But animals do have great instincts when it comes to getting sick. They'll tend to, when they get sick, they'll tend to not eat, and they'll tend to go off by themselves in a quiet place and just rest, which are things that we should do. So I think they have a really good instinct when it comes to hygiene. They don't tend to eat a lot of junk food and order out pizzas at 2 in the morning after a long night of drinking alcohol. So they have good hygiene instincts, but I don't believe that they've actually, that they are seeking out homeopathic. That's a good question. It would be good, something to look into. And Albany, you have a question?
I was just curious, do homeopaths believe in light therapy? Is that part of homeopathy?
Right. Well, so part of what I do, and I wouldn't call it homeopathy per se, I just call it being a good physician, is to educate patients about hygiene, which we define as being diet and lifestyle and exercise and all those things. So I will advise patients, I think more often than not, first and foremost, my job is to find the right remedy for the patient at that time. But sometimes the right remedy is not a homeopathic remedy. It's getting more sleep or getting more sun exposure or eating the right foods or not drinking 2 pots of coffee a day. So that could be something, if the diet and lifestyle and hygiene is way off, that could be the first thing that we address in a treatment. But if it's reasonably good, then the health should be reasonably good if it's balanced. And so then at that point, then what we assume is missing is the push to get the body to balance itself back out. And so that push comes from the remedies. So the purpose of this class or study group is going to be to teach you guys more about what homeopathy is and how it works, and I hope by watching the videos we'll be on the same page and we'll have a good idea of that. And then I'll be able to teach you, I'll be able to share my experiences in treating chronic disease with you to some degree, but really the emphasis is more treating the acute disease. So can anyone give me a good definition or difference between acute and chronic disease? Because we're throwing these words out, I feel like we should all be on the same page. Acute versus chronic disease?
Well, to me, it would be just a regular cold versus a sinus infection, which may hang on for a longer period of time.
Okay. So the time, how long it persists, has a lot to do with it. So an acute problem, I mean, a sinus infection I would still consider acute, unless it was like chronic sinusitis, where it turned into this chronic disease that was lasting. So by chronic, some people have the misconception that chronic means relates to the severity. It has nothing to do with the severity, it has to do with the time that it's persisting. So chronic disease is just a disease that goes on for a long time. It persists. It may come and go, but it keeps coming back. Or it could be constant. So it could be chronic and reoccurring at regular intervals or at random intervals. It could go away and come back. Or it could be basically a relatively constant problem. Whereas an acute disease is one that typically has come on fairly recently, and it will, if effectively treated or through the body's just own ability to heal, it will tend to resolve and not become a long-term problem. So the acute diseases is what we're going to focus on in treating in this course, because frankly, chronic disease, in order to treat chronic disease effectively, requires you to literally go through homeopathic training and become a homeopathic physician. It's really not something that you can be left to a lay person to do. It's a very challenging course of study and experience and practice, and really people who've been practicing for 10 or 20 or 30 years are still learning and truly practicing. So we'll focus on that, and we'll kind of talk about, you know, when you should be treating yourself and when you should be calling your homeopath or other type of healthcare provider. So for example, a high fever, like a severe acute infection like pneumonia, can be very easily and well treated by homeopathy. In order to take that on, you should probably have a little more experience. So for you guys, basic first aid stuff, the kinds of things that would be in a typical person's medicine cabinet, aspirin, Tylenol, Benadryl, Pepto-Bismol, you can name all these things, Claritin, all these things that a lot of people have and use on a fairly regular basis and have learned how to use through the efforts of advertising, pharmaceutical advertising and marketing, and your helpful pharmacist at the drugstore, and your mother, and all those things. All of those things you'll be able to you could be able to handle with homeopathy. And you know, my advice is that you start trying it. You watch the videos, come to the classes, get the books, which you'll need. You'll need some reference to look things up, and just start. Just try. Basically, when you look up a condition, in a lot of these books, they'll list maybe the top 10 most common remedies, and they'll give you a little bit of information about how to differentiate. So if you have a sore throat, well, is it better on the left side or the right side? If it's the left side, consider these group of remedies. If it's the right side, consider these groups. Is it better or worse in the morning or night? If it's in the morning, consider this group. And so if you get enough of those symptoms together, you'll go through these books and you'll think, oh, it really kind of fits this remedy. So try it. If it doesn't work and you're not getting better, you know, call me, call a homeopath, or if you choose to, you know, use conventional medicine, you can go that route too. If you're starting to get a low-grade fever, that's okay. You don't have to suppress fever. There's nothing dangerous about having 100-degree fever, 101-degree fever. You want to stay hydrated and drink a lot of fluids, but you can attempt to treat yourself. But if it's persisting and a day goes on, you're not better, you try a different remedy, another day goes on, you're still not better, then you need to call someone. And in my practice, I do exactly the same thing. The difference is I'll push the boundaries a little bit further because I'm more experienced and I know the point at which we can continue to try to find a remedy, and if we get it, great. If we don't, then as some of you in the room know, I'll be the first one to tell you, okay, now it's time to call your allopathic medical doctor and get a prescription for antibiotics or whatever it is you need. I wouldn't say that homeopathy doesn't always work, because for infectious disease, for example, it should always work. The problem or the challenge is that you can't always find the right remedy. Sometimes we have patients who aren't able to articulate their symptoms, or that just the symptoms are not giving us, the disease is not giving us a clear enough picture to identify anything meaningful to prescribe. So it's kind of a shot in the dark. Finding a homeopathic remedy is kind of like finding a needle in a haystack. If you have all the lights turned on and you have enough people in there sifting through the hay, you'll find it. But if it's pitch black in the middle of the night and you don't have any help, you're probably not going to be able to find it. And so that's probably one of the biggest limitations in homeopathy, is that we don't always have the information readily available in front of us for a number of reasons. The other limitations to homeopathy are just problems that have been chronic for so long that they've created destruction of tissue. So someone who's suffered a stroke and has lost, you can bring that back early on, but if it goes on for too long and there's too many brain cells that just aren't there anymore, it could be a point at which you might be able to keep it from progressing further, but you might not see much improvement. Or arthritis, when it's in the inflammatory stage, it's very easy to treat. Once it's been in the destructive stage and there's bone on bone and that's rubbing away and you don't have any cartilage left, once it's gone, it's very hard to get that pain to resolve or for that function to come back. Any questions on conditions treated or acute